Dynamic of disease transmission and control measures. So, what is disease? Disease is sickness or morbidity or illness or deviation from normal health is called disease. Transmission, it's a moving from one place to another place is a transmission, right or not? So, the dynamic of disease transmission is the question being often asked in a community health nursing. So, how this disease been transmit from the one individual to the another individual? Here, first you can see this picture. First is a source or the reservoir. Otherwise, you can tell is a reservoir, and it will be going to the susceptible host. This is a new person. We don't have a disease. This is the mode of transmission. So, resource, mode of transmission to the new host. What is called infection? So, what is infection? How the infection is coming? Infection, you can understand, this is the chain of infection. So, you have to break the chain of infection, you can prevent the transmission. Okay, what is the break? First one is the infection agent. Who is creating the infection? Bacterial, viral, fungal, protozoal, helmintics, etc., etc. So more all the agents are creating. So where they are, so they go to the, they will be where they are there in a normal skin of the human being have. Animals normally it is having water or fluid, whatever it may be, they are there in the reservoir. That's the source. They are there. So they come out. That's a portal exit. Portal exit. They come out from their bloods or the skin. I told you skin, normal flora is there present in the skin. So once they are in outside, it's okay. When they enter into portal, entry is the problem. So blood and skin and secretions. Then will be mode of transmission, physical transmission, droplet or vehicle vector, inoculation, injection, ingestion. You can tell what kind of transmission it may be. Then will be portal entries. Through that they will enter into the respiratory tract, mucous membrane, or the digestive tract, digestive mucous membrane, or to the broken skin, inoculation directly enter into the organisms. So whom it is going? It's going to the vulnerable people. Who is vulnerable people? Immunosuppressant people, or the people who are children, or the old age people, or the diabetes people, increase age and the decrease age. So like this cycle of infection. This we have learned in our medical surgical nursing or fundamental of nursing. This is the concept, the chain of infection is spreading this one. So in a community health nursing, how it is spreading. So how it is spread? So this is the source. Source, if you see that the resource or the source, you could see this picture. What and all it is there? It's a human and animal, book, cloths, plates, pencils, or the dress and handkerchief, or plate or animals, whatever it may be, inanimate objects. So there is there, and there is a mode of transmission. How it is transmission? Direct transmission, dust, droplet infections or transmitting. And the coronavirus, you can tell 1 meter it will be going. Indirect transmission 5F, food, finger, feces, fly, fomets. The 5F indirectly it will transmit. And then the vehicle, water is a vehicle, fluid is a vehicle, milk is a vehicle, juice is a vehicle, vector, arthropod, mosquito, cyclops, flies, testy flies, different itchmates, or any vector will be this one, and is the new host, is the new person without infection is there, but it is spreading from, these are all the any way it is spreading. So as a nurse, as a community health nurse, what you have to do? You have to do either the source reduction. The source reduction is a control measures. How you will be control the infection. Last we will see how to control this by the disinfectant. First we will see how to prevent it. Prevention is better than cure, right? How you will prevent it? Prevention, like a mask you have to wear, hand washing is a better prevention, gloving, gowning, and the personal protective equipment. So whatever you will be wearing, there will be prevented. Then what you will be, so prevention you can write it like indirectly, everything you can separately, vehicle, vector, how you can prevent in a separate way. Also you can write how the vector, vehicle, arthropod, how you can prevent, principles of prevention of arthropod control, you can include it. Understand? When you come to the new host, The host is not susceptible person, is a new person. He not got disease, but more chance to get disease. So you have to yearly identification. You can vaccinate him and yearly identify if he has a disease, and yearly notification of disease, yearly quarantine. Quarantine, what is quarantine? Prevent the movement of the people during, when you suspect during their incubation period, it should not spread to the other people, right or not? If you found out any of the symptoms, then will be yearly isolation and yearly treatment. Yearly isolation, missed it, you have to write it. Yearly isolation, quarantine is isolation, it's okay, but still yearly treatment. So this is how, so you understood what is that, how the infection is transmitted from the reservoir or the source, it's transmitted to the new host. So mode of transmission, direct, indirect transmission 5 F's, and vehicle and vector borne, this is the prevention, mask, hand wash, gowning, gloving and technique. So you have to, here if you see portal entry, you can prevent it, blood, how you can use the culture, all these things in a scientifically we can, in a hospital setup I can take it, but in a community setup this drawing will be better for you to draw the dynamic of disease control. Then this is the prevention of transmission of these infections. So you will using the washing technique, all these things. You have to do the source reduction and control the infections. So when you source reduction, you have to kill the microorganisms from these from the animals or whatever it may be, inanimate objects. So that you have to see the control of infection. That mainly the best thing is called the disinfectants. Disinfectant you have classified into chemical agents, sterilization, antiseptic, sepsis and sanitizer, detergents and the cleanings and cleaning soda or cleaning this one and deodorants. So these are all helping to prevent it. What are the chemical agents? Chemical agent, phenol, cresol, chlorhexide, hexachlorophane, Dettol and quaternary amino components. Quaternary amino components are the Savlon, citramide. Halogen and their components are very important. That is a chlorine, bleaching powder and the hypochlorites. That's in a liquid form. And then alcohols. And iodine, like iodine, iodospores and betadine and bovidone ointment is coming. Formaldehyde, mostly we are using in the gaseous form. Fumigation, we kill the foes, fungus, bacteria. And oxidizing agents like potassium permanganate, hydrogen peroxide, paracetic acids and all. Then metal and micros. What is metal we are using? Is it really we are using this metal? Yes, silver dioxide. To kill, especially for the newborn baby, the Treponema pallidum, that the woman who is having a sexually contact disease, venereal disease, when the child born, they may prevent the eye infections. They are using this cream. And also the iron and copper ointment, burn wounds and all, you can see silver nitrate, silver dioxide. These are all used as a tropical agent to kill the microcidal action. So this is the control of infection. It's called the disinfect. Chemical sterilization. You know what is sterilization? Hot air oven, like how oven method. So different types of boiling method. Boiling 100 degree will kill the spores and other things. Glasses and other item. Hot air oven and different equipments can be sterilized in a different form. You can just include it. And antiseptic solutions, lotion, sepsis, this one, sanitizer. You can have a pocket sanitizer, one patient to another person you are touching. Sanitizer was much helpful to control the corona, right? So these are all these disinfectant you can use as a control of the infections or the source reduction. So if there is a question is coming as a dynamic of disease transmission, hope you can write this picture. Drawing this picture, this is a resource, reservoir, mode of transmission and susceptible goes, this is the prevention. And then it's a control measures or controlled by this one. So this is how you have to deal the community dynamic of disease transmission and control measures of the infection. Thank you.